I keep returning to this concept of working and thinking in terms of three. We've talked about how each limb has three segments, and the Master Tung points are organized along this way with the numbering system. So the three segments of the legs are the feet, the lower legs, and the thigh. It's really useful for various reasons to think this way, because oftentimes we'll want to do our Dao Mas by doing 2 or 3 points in any particular segment, okay? So a very common, well-known Dao Ma is the lower three emperors on the deep front line. So those are the 3 needles here between spleen 6 and spleen 9 that are most sensitive. I can also reach liver 8 and the 3 yellows in the Tung system, just proximal to liver 8. So this is a really nice position to reach the deep front line and the leg yin meridians. However, the points between the metatarsals are not so available here. So if I want to needle any of these 3 point groups, the Dao Ma of spleen 3, spleen 4, kidney 2, lower 3 emperors, or the liver points, I've got easy access. I've also got good access to, just bring this knee back a bit, I've also got access to the bladder meridian. So I'm now at UB57. And I'm considering this region from UB40 down to the Achilles tendon. So I can easily palpate here. I've also got access to the lateral line and the gallbladder meridian. We've got the lateral 3 passes in the fibularis longus muscle, and I can easily apply a cross fiber stimulation here. Okay, this is a really nice technique to do on this muscle, and it responds really well to cross fiber stimulation. I've also got access to GB33 and thigh 3 springs, which is the Master Tung Dao Ma using essentially GB33 and 2 more points proximal to that. I've also got access to GB31 and thigh 9 miles 3, and I can easily just do things like lean in if I find an ashi point there, or you know how when you press them and they're like, yeah, that feels good. I'm not working too hard here, right? And I might have some needles in here and still determining through palpation what gallbladder line or lateral line points I want to do, okay? Now, this point group that we're going to be working with today and discussing more, thigh 9 miles 3, where we have GB31 and then a point 1.5 sun posterior and 1.5 sun anterior. This is a really interesting point combination in the Master Tung system because we're using GB31, but by moving and doing another point 1.5 sun posterior, that puts us in the superficial back line. Okay, and if we go anterior, then we're in the superficial front line. So we can get all 3 leg yang meridians with this little Dao Ma. Super powerful. You can use it for hip pain, back pain, neck conditions, migraines, hemiplegia as well, facial conditions, facial paralysis, a variety of cervical disorders, and other things as well. But I've covered the primary things that we'd use those point groups for.